Hey everyone. Today, we're diving into the ongoing Ebola outbreak in the Democratic Republic of Congo, a crisis that has been making headlines and raising serious concerns. This outbreak is not just a medical emergency, it's a complex issue with deep social and political implications. So, let's break it down and explore what's going on. First things first, the numbers are staggering. As of the latest data, there are nearly 4,000 confirmed cases of Ebola, with over 1,700 deaths. That's a 45% fatality rate, which is alarmingly high. This outbreak is the second largest in history, only surpassed by the 2014 to 2016 West Africa outbreak, which had over 28,000 cases and 11,000 deaths. The speed at which this outbreak is spreading is unprecedented, and it's in one of the most challenging environments you can imagine. The epicenter of this outbreak is in Ituri, a remote and vulnerable area in eastern Congo, near the borders of South Sudan, Uganda, and Rwanda. This region is already struggling with rebel conflict, which has made healthcare access even more difficult. Families in Ituri are reporting that many frontline workers have gone on strike due to a lack of pay, which is exacerbating the crisis. Aniset Baluku, a resident of Bunia, the capital of Ituri, blamed the death of his two brothers from Ebola on the strike, highlighting the dire situation. Now, let's talk about the virus itself. The Bundibugyo virus, which is causing this outbreak, has no approved treatment or vaccine. Local officials believe it began in a remote area long before it was declared on May 15. This virus is particularly dangerous because it's not just spreading rapidly, it's also being detected late, which contributes to the high fatality rate. Late detection means that by the time cases are identified, the virus has already spread further, making it harder to contain. One of the key challenges in this outbreak is contact tracing. According to Dr. Jean Kazier, the head of the Africa Centers for Disease and Control, at least 60 to 70% of new cases are coming from people who were not monitored after exposure to patients. This means that the current response is not reaching communities quickly enough to break the transmission chains. The medical charity Doctors Without Borders agrees, stating that the response is expanding but still not fast enough. Now, here's where it gets even more complex. The strike by frontline workers is not just about pay, it's also a symptom of deeper issues. These workers are demanding improved wages, which is a reasonable and necessary request. But it also highlights the lack of investment in healthcare infrastructure in the region. The strike is a cry for better working conditions and a more robust healthcare system, which is crucial for not just managing Ebola but also for addressing the underlying health needs of the population. In my opinion, this outbreak is a stark reminder of the interconnectedness of global health issues. It's not just about the virus, it's about the social, economic, and political factors that contribute to the spread of disease. The strike by frontline workers, the late detection of cases, and the lack of approved treatments all point to systemic issues that need to be addressed. We need to think about how we can better support healthcare workers, improve healthcare infrastructure, and address the root causes of the outbreak. What makes this really interesting, and also deeply concerning, is the potential for this outbreak to spread further, especially given the current political and social climate in the region. The conflict in Ituri and the lack of access to healthcare are creating a perfect storm for the virus to continue spreading. It's a situation that requires urgent attention and a multifaceted approach to address the immediate health crisis and the underlying issues that are contributing to it. In conclusion, the Ebola outbreak in the Democratic Republic of Congo is a complex and urgent issue that requires a deep understanding of the social, economic, and political factors at play. It's a reminder that global health is not just a medical issue, it's a human issue that affects us all. So, let's keep the conversation going and stay informed about this critical situation.